Welcome to the Deep Dive Podcast by OrthoRadio and OrthoTV, powered by OrthoAI. Today, we're diving into, well, a fascinating study, I think, led by Dr. Vaibhav Bagaria. It was published in JBJS Reviews back in 2021. And it really kind of proposes a new way to classify varus knee deformity, in osteoarthritis.
Right.
What's interesting is it really emphasizes that it's more complicated than just, that hip, knee, ankle angle. There's more to it.
Yeah, absolutely. I think, a lot of times we get caught up on that HKA angle and it can be, misleading when we think about, what we need to do for these patients, especially when we think about surgical intervention.
For sure. So before we really kind of unpack the study itself, let's give our listeners just a little bit of kind of a high-level overview of the methodology and the key findings.
Okay. Sounds good.
Just to set the stage.
Yeah. So Dr. Bagaria and his team at Sir H.N. Reliance Foundation Hospital in Mumbai, they conducted a prospective observational study, and this included 100 knees that were scheduled for total knee arthroplasty.
Gotcha.
And they basically, took radiographs of these knees and classified the varus deformity into 3 stages.
Okay.
Stage 1, 2, and 3, based on the HKA angle, which, represents the severity of that deformity. They also then further classified the location of the deformity, so whether it was intra-articular or extra-articular.
Okay, and that's important, right? Because if it's extra-articular,
exactly,
it's a different ballgame.
Totally different. And, we think about extra-articular, a lot of times that might be coming from constitutional varus, and that's a whole other, beast in itself.
Yeah, for sure. And then, so they looked at the location, they looked at the HKA angle, and then did they also look at how severe the osteoarthritis was in the knee?
Yes. So they looked at 10 different radiographic features to assess the osteoarthritis severity, and then they graded them based on A, B, and C.
Okay.
And grade C being, the most severe form of osteoarthritis.
Gotcha. Okay, so they kind of broke things down by the angle, by the location, and then by kind of how bad the arthritis was.
Exactly.
Okay. And so what were some of the key takeaways from this study? What was interesting, or were there any surprises?
Yeah, I think one of the most important things that they found was that a significant proportion of knees with milder varus deformities, so they were looking at stage 1, had actually grade C osteoarthritis, which is the most severe.
Wow, so even though the angle wasn't that bad,
exactly,
they had really bad arthritis.
Exactly, and that's something that we might not always think about. We might see, stage 1, it's a pretty, straightforward case. But, they found that 48% of those cases actually had grade C osteoarthritis.
Oh, wow.
Which is, pretty significant.
Yeah, that's a lot. And so, that's really important for us to think about, as people who are treating this.
Yeah.
Because, it's not always as simple as the angle's not that bad. They must not have that much arthritis. Because clearly, based on this study, almost half of them had really bad arthritis.
It really highlights that, even though it seems like a mild deformity from the outside, we need to do a good job at evaluating these patients and making sure we get good radiographic images, because there could be a lot more going on than what we see externally.
Totally. So I guess take a step back for a second.
Yeah.
Why is varus knee deformity so common in osteoarthritis anyway?
Yeah. So, it comes down to the biomechanics of the knee, right? So the knee is not perfectly straight.
Right.
Naturally, we're born with, a little bit of an angle.
Right.
And so when we think about the way that the knee is loaded and just the everyday stresses that we put on our knees, the inner compartment, or what we call the medial compartment of the knee, tends to see more wear and tear.
Okay.
And as that cartilage starts to wear down,
right,
it can lead to that varus deformity.
So it's kind of like a vicious cycle almost.
Exactly, yeah.
Because the more it angles in, the more it wears down, and the more it wears down, the more it angles in.
Exactly.
Gotcha. And now, the study talks a lot about how just measuring a hip knee ankle angle isn't enough. And I think we kind of already hit on that. Yeah. But why? Why can't we just rely on that angle?
Yeah, I think, it's a good starting point.
Right.
But 2 knees can have the same HKA angle.
Right.
But one knee might have more of the deformity within the joint itself, which we call intra-articular.
Okay.
Whereas the other one might have it more so in the bones above or below the joint, which is extra-articular.
Oh, yeah.
And that's where that location comes in. And it can be really helpful when we think about planning our surgery.
For sure. Because, I mean, if it's in the joint, you might be able to do something relatively straightforward.
Right.
But if it's in the bone,
completely different ballgame.
Different ballgame.
Yep.
So you mentioned that they looked at 10 different things on the x-rays to figure out how bad the arthritis was.
Mm-hmm.
Can you kind of walk us through maybe a couple of the more interesting ones? Like what are they actually looking at, and how does that tell you how bad the arthritis is?
Yeah, so some of the things they looked at were, things like subluxation, so how much the tibia is translating.
Okay.
They looked at bone defects, so that's basically just, areas where the bone is worn away, and they can vary in size and depth.
Okay.
And then, other things like bone remodeling, so, the body's way of trying to adapt to the changes in the joint.
Interesting. So it's almost like it's trying to
compensate.
Yeah.
Yeah.
Interesting. So I guess the more of those things that are present,
the worse it is.
The worse the arthritis is.
Exactly.
Gotcha. And so, I mean, we talked about this a little bit, but going back to that finding of 48% of patients with stage 1 Varus having grade C osteoarthritis.
Right.
Why is that finding such a big deal? And how should it change, how we're treating these patients?
It really just highlights that even though we think it's a lower grade varus, it doesn't necessarily mean that there's not severe osteoarthritis within the joint.
Right.
And so we need to do a thorough evaluation of all of our patients, even those who, might seem more straightforward.
Right.
And we need to really be cognizant of those 10 radiographic features and really understand, what we're dealing with.
So it's almost like we need to treat everybody as if they might have the worst case scenario.
Because you never know what's going on inside.
Exactly.
Until you really take a closer look.
And it sounds like, what I'm hearing from you, and I think what Dr. Bagaria is saying, is that we can't just rely on how it looks from the outside.
Exactly.
We really need to get in there, look at the x-rays, and really be thorough in our assessment.
Absolutely. Yeah, we need to take that holistic approach to really get a good understanding of the patient's condition.
Totally.
And I think that's one of the big takeaways from the study.
For sure.
I think, it emphasizes the point that it's not just about the angle. It's about, really understanding where's that deformity coming from? What's the severity of the osteoarthritis? Are there constitutional variations in the anatomy that are contributing to this?
Right. So it really is kind of a personalized kind of a way to look at it.
It's personalized medicine.
Yeah. So speaking of that, you mentioned constitutional varus a couple of times, and I kind of glossed over it.
Yeah.
But what is that exactly, and why does it matter? How did that play into this whole thing?
Yeah. So, constitutional varus is essentially a variation in normal anatomy. So some people are just born with more of an inward angulation of their legs.
Okay.
And so, for some people, it might not cause any problems.
Right.
But in the setting of osteoarthritis, it becomes really important.
Because then it's like you're kind of fighting against their inanity.
You're fighting that natural tendency for their leg to want to go into that varus.
Right. So even if you fix the joint itself, if you don't address that,
right,
it's still gonna
want to go back to that.
Yeah, it's gonna want to go back to where it's comfortable.
Exactly.
Right?
Exactly.
So how do you factor that in then? How do you, when you're thinking about doing a knee replacement on somebody like that, or I guess really any surgery, but how do you think about that?
Yeah, I think it all comes down to, again, that personalized approach, right? So, not all varus is created equal.
Right.
And you really need to understand the patient in front of you. What's their anatomy? What's the cause of their deformity? And then tailor your surgical plan based on that.
Gotcha. And so, this classification system that Dr. Bagaria kind of lays out, it seems like that's really kind of the first step towards that.
Exactly.
Because it's not just, it's more nuanced.
It gives you more information, essentially.
Right.
So, before we were just looking at the degree of the deformity, and now we're saying, okay, well, where is it? How bad is the arthritis? And that can really help guide our surgical planning.
Can you give me an example? How would that actually change what you do in the operating room?
Yeah. So, let's say you have a patient who comes in and they have what seems to be a pretty mild varus deformity, based on their HKA angle.
Okay.
But then when you look at their x-rays, you're seeing maybe some subluxation, you're seeing a lot of bone defects.
Right.
And so even though that angle might not be that bad, now you're thinking, okay, maybe this person has, really severe osteoarthritis.
That's right.
And so instead of just doing, a standard knee replacement, you might say, okay, maybe this person needs an osteotomy, or maybe they need a different type of implant, to help accommodate for that deformity.
So it's like you're not just treating the x-ray, you're treating the patient. The patient.
Yeah, exactly.
Gotcha. And you just mentioned osteotomies, and I know we've talked about those before, but can you just remind everybody what that is? And I mean, where does that fit into this whole picture?
Yeah, so, an osteotomy is basically a procedure where we cut the bone and then we realign it.
Okay.
And so in the setting of Varus, we're essentially trying to shift the weight-bearing axis away from that damaged compartment.
So it's almost like you're kind of straightening the bone out.
Exactly.
And then that kind of takes the pressure off of
the worn out cartilage.
the worn out part.
Exactly.
Gotcha. And so, I mean, when do you decide to do that versus just like a knee replacement?
Yeah, that's a great question.
Because I'm sure there's some people you could go either way.
Exactly. It's a lot of factors that go into that decision.
Yeah.
We think about the patient's age, their activity level,
Right.
how severe the deformity is, their overall health. And so it's really a discussion that we have with the patient.
Right.
We go over the risks and benefits of each option, and then we come up with a plan together.
And is that where, I mean, does this classification system help with that conversation?
Absolutely. Yeah.
Because you can kind of say, okay, you're like a stage 2 grade C, and this is what that means. And
it gives us a common language to use so that we can communicate effectively with our patients.
Gotcha. So, let's say we are going to do a knee replacement.
Okay.
How does this research, how does it change how we think about doing a knee replacement on these patients?
So, I think for a long time we've done knee replacements using kind of a standardized approach.
Right.
One size fits all.
Right. Everybody gets the same implant.
Everybody gets the same implant.
More or less.
Yeah, more or less. But, I think we're moving away from that. And this research really highlights that we're moving towards a more personalized approach to knee replacement. So really understanding the patient's anatomy and then choosing an implant that's going to fit their specific needs.
So it's kind of like instead of going to the store and buying
Right.
off the rack, it's like getting a tailored suit kind of.
Exactly.
Yeah. So when you're actually doing the surgery then, I mean, what are some of the things that you have to think about specifically with these Varus knees that maybe, we wouldn't think about otherwise?
Yeah. So one of the big things is ligament balance.
Okay.
And, this can be really tricky in these Varus knees because the ligaments on the inside of the knee are often stretched out.
Okay.
And the ones on the outside are really tight.
Right, because it's all kind of
Dude, so
scrunched up on that one side.
Exactly. Yeah.
And so if you just put the bones back where they're supposed to be,
Right.
and you don't address that,
It might not be balanced and it could be unstable.
yeah, it's going to be wonky. Right.
Exactly.
So how do you fix that then?
So there's a few different ways we can do it.
Okay.
Sometimes just correcting that bony alignment is enough.
Okay.
Especially if it's a mild deformity.
Okay.
But in more severe cases, we might have to do what's called a ligament release.
Okay.
Where we basically go in and we cut, or we loosen up that tight ligament,
Okay.
or we can do a ligament reconstruction.
Okay.
Where we actually take a graft and we replace or we reinforce that ligament that's been stretched out.
So it's almost like you're tightening up the loose ones and loosening up the tight ones.
Exactly.
So that's all
to try to get a
balanced.
Yeah.
So you're kind of adjusting the tension on everything to make sure it's all
to make it's all nice and stable.
Yeah. So, I mean, we've talked about during the surgery what you have to think about.
Mm-hmm.
But what about afterwards? How does understanding all this stuff, how does it change rehab?
Yeah, that's another really good point. So, rehab, I think, just like surgery, is also moving towards a more personalized approach.
Okay.
So we can't just say, okay, you had a knee replacement, here's your rehab protocol.
Right.
We have to think about, what did we do? How severe was the deformity? What kind of things did we have to address in surgery? And then tailor that rehab protocol to the individual patient.
So, if somebody had a really bad Varus,
right,
and you had to really loosen up a bunch of stuff and
Their rehab's going to be different.
It's going to be a lot different than somebody who just had kind of like a, a mild varus and everything kind of went back into place nicely.
Exactly.
So it seems like, I mean, the big takeaway here is that,
Yeah.
we really have to be thinking about these things like all the way along.
Absolutely.
It's not just like, oh, it's a varus knee. We do the same thing every time.
It's not one size fits all.
It's not. Yeah.
Yeah.
No. Gotcha. Well, this has been, I mean, a really interesting discussion.
Yeah.
And I think a lot for us to think about.
Yeah. I think Dr. Bagaria's research is really important, and it really highlights, just the complexity of this deformity.
Yeah.
And that we need to really understand it so we can, provide the best care for our patients.
And it seems like we're learning more all the time.
Absolutely. Yeah.
So what we thought was, the right way to do things 5 years ago
Right.
might not be the right way to do things today.
Exactly.
So it's on us to keep up with the literature, keep learning.
Yeah, I think that's one of the most exciting things about orthopedics is that, it's constantly evolving.
Right.
There's always something new to learn.
Always new stuff.
Yeah, new technologies, new techniques.
Yeah, totally. Totally.
It's a really exciting field to be a part of.
For sure. For sure. Well, I think that's a perfect place to wrap it up.
Okay, sounds good.
So thanks for joining me today.
Yeah, thanks for having me.
And to our listeners, thanks for tuning in.
Yeah, thanks everyone.
We'll catch you next time.